Good evening, ladies and gentlemen. I'm Nina Pearson, GP and Vice Chair of the Health and Wellbeing Board. I'd like to welcome you this evening to the Health and Wellbeing Board for Luton. I'm going to chair this evening because Hazel Simmons is not available today. So I wonder, Bert, would you like to tell us the apologies that we... These instructions first, right? Thank you. So just to remind you that this meeting is live streamed to the public, and a recording of the public part of the meeting will be available on the council website within 24 hours of the meeting. So people who are online and joining the meeting, can we ask that you use the hands up button to indicate when you have a question or comment? And those in the room wear masks on entry into the building, but you can remove them when you're seated. And please remember to use the microphone when you're speaking, and turn that on and then off when you've finished. Thank you. And for those who are on the Teams, if you could keep your cameras on, that would be helpful, please. And can we have phones on silent mode? Thank you. So just to get my agenda up. So it would be helpful, please, if you could, Bert, if you could tell us the apologies for this evening.
Yes, Chair. We have apologies from Councillors Simmons and Javed Hussain and Gilbert Campbell. Apologies from David Carter, who is substituted by Paul Tissing, Medical Director. We've got apologies from Dr. Carolyn Cuss, Lucy Nicholson. That is it, Chair, which means that we've got 6 members of the board present. We are in quorate. So the advice is that you can proceed informally and with the resolution only to be ratified at the next meeting.
Thank you. Okay, so we'll make good notes of our decisions, and as you say, they will need to be ratified next time. So the next item on the agenda is the minutes of the meeting on the 14th of December. So could I ask, are there any comments or corrections on those minutes? I won't go through them page by page, but I will take it that you've had a look at them and read them. I didn't spot anything earlier on that was an inaccuracy, so I'll take that as agreement. Sorry, that's a true record of the minutes, and I will sign those accordingly. Thank you. Any disclosures of interest in relation to agenda items? No, thank you. And any urgent business?
None, Chair.
Thank you. Any references from committees or other bodies?
None, Chair.
Thank you very much. So we'll move on to the reports section of the meeting. We do have 1 or 2 new people in the meeting today. So as you speak, please can you introduce yourself and say what your role is, so that we're all aware of who's joining us today. So the first item is the update on COVID-19 in Luton and the Health Protection Board. And Sally, do I take it that you're going to give that report, please?
Yes, thank you. And for those that don't know me already, I'm Sally Cartwright. I'm the Director of Public Health for Luton Council. So the paper was circulated yesterday with the most up-to-date figures and position. So as of today, just to update on the case rates, our rates are 666 per 100,000. So there is at the moment a considerable decrease in the cases across Luton, which is in line with the national trend. We're currently just around the same as the national average and just below the East of England average, which is positive. We're also looking at a stable position in the hospital, and as last time I updated, we have seen a much higher background case rate, but lower number and proportion of hospital admissions related to that. And at the moment, as I've said, the case rates are decreasing quite considerably. On the 21st of this month, so in less than a week, we're expecting the announcements from the government around living with COVID and what that means. So there has been quite a lot of policy changes around the no confirmatory PCR needed now, and isolation changing, and then we will await and see what happens after the 21st of February, but expectations of more announcements around how we continue to sort of go back to normal, as it were, with COVID, and what that means for policy. We do still have community testing at the moment, and that has continued to be a really strong part of our response to COVID. We are seeing a decrease in the use of community testing, and particularly in PCR, which is in line with the trends nationally, and you would expect with the announcement of not needing confirmatory PCR. So a lot more LFD tests have been carried out. Our vaccination programme continues to be implemented across Luton, continues to be really strong partnership working between CCG and other NHS providers and ourselves. And we have continued since the new year. We've had an additional site in the mall in the old post office, which has been proving to be really successful and building in success. So we're not seeing the large numbers that we had early on, but we're seeing a good steady stream through the mall, and that's not seeing a decrease over the last few weeks. So nationally, the numbers of being vaccinated is declining, but it's not, because there's a smaller cohort to be vaccinated now, with so many people having completed their vaccinations. So, but in Luton, we are still seeing a good stream of people being vaccinated, and still seeing first and second doses as well coming through, which is positive. We've also now got the opportunity for people to verify their vaccinations that were undertaken abroad. So that offer is now live in both Redgrave and the Mall, which is great. So that's been taken up quite strongly as well. So that's a really positive development in the vaccination programme. We also have some additional funding to deliver the COVID community champions specifically around the vaccination. So we'll be building on that, building in more outreach using our mobile vaccination vehicle, and engaging with particular community groups through that particular project, which I can bring further updates at a subsequent meeting. So I'll pause there. Thank you.
Thank you, Sally. So before I invite comments or questions, just in terms of giving greater screen coverage, I wonder, Paul Teesey, could you turn your camera off, please? Because you're competing with Sally at the moment. Thank you, that's great. So learning the tricks of the technology. Thanks very much. Yes, Khadija.
Thank you. I'm Khadija Malik, portfolio holder, public health and wellbeing. I just wanted to know, in terms of, you mentioned that where people aren't testing for doing the PCR test to check for COVID, how is it that we're going to be able to safeguard the most vulnerable if people aren't going to be testing? Because we know that people could be carrying without having the symptoms. So is there anything in place for those vulnerable groups that are, are still out there?
Thank you. Good question. So I think that's what we are waiting to hear further guidance on the 21st. So I think that the direction of travel will be much more around ensuring protection of the most vulnerable, and making sure that systems and plans are in place for that, and making sure that we have the right surveillance to be able to know who that is. So that will be a key part of the plans going forward, but I haven't got the details of that yet, because we need to be flexible to adapt to what gets announced on the 21st. But yes, I think generally there is a sense that there is less PCR testing being undertaken, and there's likely to be a bigger gap between our reported case rates and the reality of the position locally, both for us and nationally. I think that gap between recorded and estimated prevalence has increased considerably.
Thank you, Sally, because I think in terms of an event that I went to most recently, we found out that the majority of people caught COVID. It wasn't recorded because they did the lateral flows at home, and some more sensible enough to start isolating and go following the rules. But the concern then was raised around the most vulnerable that may have attended and not know that others that may have been affected at that event. So thank you.
Yeah, absolutely. That's something we need to be really mindful of.
Can I follow on with this same topic? So we're waiting for national guidance on the 21st. Do you have any anticipation of whether there will be flexibility for local public health teams to adapt to the needs of their local population, and whether they'll have the resource to be able to do that, or will it, suppliers of finance and kit dry up, I suppose, is the question.
Yeah, and I don't know the answer. So we, as a public health, as a council, we've received additional funding for COVID response, and we are still to hear what that will look like, if anything, next year. So I don't know is the answer to that. And I think over the course of the pandemic, the response and expertise of public health teams has been recognised, and knowing that we have the ability to flex and adapt, I think, has been recognised. So hopefully there will still be that ability to respond in different ways depending on local need.
Thank you, Sally. So could I ask, are there any other questions or comments from the people online, first of all? I'm not seeing any hands go up or in the room. No, thank you very much then for the update, Sally. I just wonder, we have another infection that's appeared in the local area. Would this be an appropriate time for you along with Dr. TC, Mr. TC, to talk about the Lassa fever? Just to give a bit of information.
Yes, I think that is an appropriate time. We'll hand over to Paul. I think he has some updates on that for us.
Good evening, everybody. I'm Paul Teasey. I'm the Medical Director at Bedfordshire Hospitals. The information that
Sally, can you go off camera and Paul come on?
Yeah, I was just realising that, sorry.
Thank you. Clearly, colleagues here and the public will be aware of information that has been published. There was an initial statement published by the UK Health Security Agency on the 9th of February, outlining that there were 2 confirmed cases of Lassa fever and 1 probable case. There was an updated statement provided by the UK HSA on the 11th of February, confirming that sadly 1 case had died, and that is within Bedfordshire Hospitals NHS Foundation Trust. NHS East of England also published a statement on the 11th of February confirming that there is a regional major incident in progress, and that is around staffing in a number of clinical areas across the region. I think from the perspective of what else I can say, because it is sensitive information, I think that is the appropriate information that we can share at this stage. I will note that the UK HSA has set up a helpline for members of the public who are concerned. And the number for that is 0300 303 2779. So I think that is probably all I can say at the moment. I think it's important that any questions or queries are directed to the UK HSA. We have been working very closely in conjunction with them throughout the last week, as well as colleagues with the CCG and NHS East of England. And clearly that's been escalated up to the national team.
So thank you very much for that update, Paul. And as you say, the national agency are coordinating this, and there is a contact telephone number for other queries. So long I'm looking around the room, I'm not seeing anyone raising any other questions. Bearing in mind that there will be limits to what can be said.
Yeah, and that's what worries me, because I did have a question, but I think Paul is actually referring us back to the other body to make inquiries, because it's around how contagious it is. I understand it's quite a serious illness, but I also understand it's less contagious than, you know, for instance, COVID. So Lassa fever is actually harder to spread. So just I mean, I don't know if Paul can answer that particular question, because I remember a while ago when COVID began and we were told by Sally's forebearer, well, we've only got the one, you know, COVID incident, but in my mind, only one is enough. It's sufficient to lead to many, many more. So what's the risk, if you like, in terms of it spreading? Is that something that we should really be bearing in mind, or is it just an update that you've given and it's not a great concern in terms of its ability to spread?
So I'm sure we could answer some general questions on risks of infection, the way the disease is caught, in general terms. Either Sally or Paul.
I mean, I pick that up. I think that's covered very well in the UK HSA's public statements, which are on the gov.uk site, and that does explain the risk of transmission, and also it does confirm the risk to the public is very low. And if we were comparing that to COVID, I would agree that the risk of transmission is lower than with COVID, but perhaps I would direct people to look at that statement, which covers this in quite clear detail for the public.
So Sally, is this something that we could perhaps share around members of the Health and Wellbeing Board, you know, circulate that statement so that they have the direct information from the agency?
Yeah, I'm sure we can. And just to add to that, in terms of transmission, it is a different route of transmission as a virus, as a disease. So COVID is airborne, droplet, and Lassa fever is secretions and blood. So it's a completely different transmission route. So because of that, the sort of the risk of ongoing transmission across the public, if you did come into contact with the case, is much lower.
And I suppose the other bit to add is that health workers and those who have been in contact with cases have already been contact traced and advice given, according to the information I received into my email box today. So contact tracing has taken place, and very detailed contact tracing and appropriate advice to those who were involved in care.
That's correct.
Yeah. So thank you for that update, and obviously we will keep alert because it's a rare condition.
I was going to ask what you just asked, but following on from that, I was going to say, has it impacted on any of the services? If, you know, with staff that have been traced, does that mean there'd be an impact on services within the town or not?
So I can ask that question. Is there any impact on services as a result of the support and advice that healthcare staff have been given in relation to these cases?
I can answer. There is impact on services across the east of England, and that is why the region are managing this as a major incident. And I'd like to continue in that way for a few days.
Thank you. It's like being at home and going on mute, isn't it? So we will move on now to the next item on the agenda then, which is the Talk, Listen, Change Project Action Plan. Jamimi, you're giving us this report today, so thank you very much. Go ahead.
Good evening. So today's report is about really to update the board on the action plan related to the findings of the TLC report, and also to get any feedback from the board that they may deem important or reasonable or necessary. So you may remember a while back that we convened a meeting which was specifically looking at the findings of the TLC research that was done and led by the University of Bedfordshire and working with community representatives, voluntary sector statutory organisations, focusing on key community groups which we're familiar with now: Pakistani, Bangladeshi, Indian, Black African, Black Caribbean, to look at the disproportionate effects of COVID during that time and during the height of the pandemic. Some of the findings in this paper that I've summarised is around participants' views of the disproportionate impact of COVID, and the fact that a lot of the participants understood the key risk factors relating to COVID and understood that it was, that if there were lifestyle issues or underlying health conditions that put them at greater risk, they understood that age put them at risk, and living conditions all increased the risk of transmission. I should say that in terms of the methodology, over 1,000 questionnaires were received from community members. There were several focus groups done and also interviews, just as a reminder. Another finding of the research was that there was some barriers to testing, which again the board has had several papers that have come forward to tackle those issues around accessibility and availability of not just testing but also of actually having the vaccine. Something that may not be very obvious in terms of the research is about the impact and effects of information dissemination and mental health. So participants felt that friends and family were good conduits for information and disseminating COVID messaging. Others felt that they didn't have words to describe their mental health. There was a huge impact on people's anxiety, on people's around bereavement, on people's just general mental health. So from the findings, as I said, we've done the talk element where we've engaged with our communities. Public Health now are leading a coordinated next step approach where we have put together an action plan. This action plan is receiving input from a range of organisations. For example, we've got Active Luton, Health Watch, we've got the Recovery College, we've got our mental health providers, we've got Total Wellbeing who do social prescribing and other mental health. So we've got a range of providers who have all contributed to 18 specific actions. And this action plan has 5 themes. So key themes are communicating across Luton. This is about using the findings to understand and better communicate. So how do we do that? Through using social media, utilising trusted community members, utilising schools and family members in order to get health messaging out, in particularly COVID messaging. So an example of this is that we are in the process, it's taken us a while, but we have now a draft, easy read, accessible version of the research project, which we will be disseminating using the community researchers as one way. We'll put it on our web page, as in Luton Borough Council's web page, and we will encourage our partners to also disseminate the information. Another key theme is improving access to physical activity. This was quite clear within the findings, and we found that ethnic elders and women in particularly showed that they really wanted to participate in physical activity, but because of social distancing measures, they found that quite hard, and there was a lack of women-only facilities, and because of the lockdown, there's a lack of resources, community resources in which people could access. So as a result, one of the key actions that we have done and boosted recently is to do a short survey targeting women and girls, so 14 years old and above, to understand a bit more about what those physical activity intentions and preferences would be. And we're doing that in partnership with Active Luton, who can then deliver key activities across the borough, not just in specific areas. In terms of improving mental health and social isolation as a theme, we have worked really hard with our key providers, ELFT and Total Wellbeing, to look at culturally adapted CBT. And I'm pleased to be able to inform the board that we are, as of today, really making quite some strides. We've got ELFT, who have peer befrienders, and they are able to engage with people who have don't meet the threshold of normal total wellbeing IAP services. So those who are just below those thresholds, we're able to hold them and provide them with support. And once that support is in place, we also then handhold them onto total wellbeing, where we will have therapists who will be able to be culturally trained in order to do therapy with these patients and service users. The other theme that we have is self-help and resilience. So we're keen to encourage our communities to learn to build their own resilience around mental health in particularly, but also around their knowledge around health conditions. So we're working with providers such as the Recovery College and Luton Adult Learning Team, and we're hoping to beef that piece of work up a bit more in order to look at health literacy with the Luton's Adult Learning. So in order to roll out and action these activities, 18 of them, we have an operational group which has met twice since October last year, and we have another meeting at the end of this month. And essentially it is to bring together partners, system leaders, to action plan, to drive forward specific actions and share information and ensure that we are meeting those that did respond to the survey and the focus groups, that we meet those needs as best we can as a town. I think I will leave it there. I have attached to this report the executive summary, should anyone wish it, and I also have, if anybody would wish, the action plan.
Thank you very much. For those who aren't familiar with the terms, CBT is cognitive behaviour therapy and IAPT is improving access to psychological therapies, for if anybody's new to those terms. So thank you very much. I thought it was an interesting report and interesting themes coming through. And I was really pleased to see that there was an ask around physical activity, because so often we talk about the fact that our residents are not as active as we would like them to be, and here they are asking for the opportunity to be active, and I thought that was really, really positive, and that demonstrates the understanding in our population that physical activity is really good for general health and well-being. So I'd like to invite any questions or comments that anyone has, please. Yes, Amanda.
Thank you. I'm Amanda Lewis, the Director of Children's Services for Luton Borough Council. Thank you for the report. I'm just interested because I could see from the report that the focus had been on people over the age of 16. And I just wondered, in terms of taking a sort of more inclusive approach, whether there was an opportunity to engage with younger people, given how important the agenda was, and if the answer to that is yes, we can help facilitate some of those conversations.
Amanda, we would definitely welcome that, and as I said at the beginning, I'm hoping that the board will find some more avenues where we've missed out, and certainly it's been very much driven by adults. The physical activity survey is from 14 and above, but of course we're not getting any of the younger children in as part of that. There also is opportunities, of course, to disseminate health information to using schools, but I think we could definitely beef up our children and young people element too.
Thanks. I mean, I think it links, Sally, to some internal conversations that we've had regarding the kind of physical strategy or the physical activity strategy and the interface that Matt Hudson is going to be having, particularly linking with primary school leads and the importance of the kind of ownership and engagement and opportunity to engage at an earlier point, particularly given the concerns about achieving healthy weight and activity and what that means for emotional well-being for our children.
Yeah, absolutely. And so at the moment we've got, sorry to jump into Emma, at the moment we've got an operational steering group for the findings of the TLC project and research, but what we are looking to move to is embedding those findings across all the different strategies that they're related to. So within the physical activity strategy that's being developed now, which will I'm sure come to this board in the not so distant future, we will make sure that we're embedding the findings from Talk, Listen, Change, so it's really informing some of the key strategies that we've got rather than just a standalone bit over here, and I think that's really important. So Matt, who's leading the physical activity work, has linked in quite closely with Chimeme around some of the findings and working those through into the strategy.
So the ask of this paper was that we note it, but also that as a health and wellbeing board, we provide comment and direction of further work to do. So we've got that aspect of starting younger and how do we become more inclusive with the families and children. I'm not, yes, Khatija, thank you.
Thank you. I think being part of the Talk, Listen, Change and initially starting through the health inequalities and the impact of COVID on particular groups, I think to build on that and really open it out to all communities in terms of how we can deliver the inequalities that have existed and how services can really input in different ways and working collaboratively in ensuring that preventing different types of health needs in the future is really, so I think it's really positive in terms of we had a real response from communities that came forward. We used the university, so I'd really thank Chimeme for the piece of work that was done in collaboration with the university with this research, and it'd be really, really good and to make sure that we can really open this out. And really, it's not just there, services aren't just there for those particular groups, it's open to all groups and the opportunities for everybody to come forward and really take part within this. And this was, it says on their Talk, Listen and Change. So it was about speaking to communities and then listening to them. And now we're on that part of making those changes. They won't be drastic. There are some that are happening, but it's really working collaboratively to ensure that we are aware. And sometimes it's about awareness and people knowing where things are and going to them and accessing them. Thank you.
Yes, Tasneem.
Councillor Tamina Salim. I'm the portfolio holder for Children's Services. I forgot to mention earlier, apologies. Yes, so the change aspect, obviously there are actions within this document. Will there be some kind of follow-up to see what the impact of that change has actually been? So perhaps a follow-up survey of some kind, or how would it be measured, essentially?
So that's a really good question. So a lot of the activities, our actions in the action plan are projects, big projects in themselves. So we do need to continue. So for example, the the cognitive behavioural therapy work and IAPT, that's got an evaluation piece that we're working with the University of Beds with to start with. At least some of the other things, they might be just quick and easy, and then we'll get service feedback from those. But some of the big issues will build in evaluation, certainly, to make sure. But they're all actually, it's a program of activities as opposed to short, sharp projects.
Thank you. Thank you. So any other comments and questions? No, thank you very much then. And we look forward to ongoing progress with that. Thank you. So you've taken note of the areas we've suggested, stretching a little further, and we're noting the actions in that report. Thank you. Next item on the agenda is the Children's Trust Board report.
Thanks, Nina.
Chair.
To carry on.
Thank you. So before the board tonight, we've got the minutes of the last Children's Trust Board meeting and the work programme of the Children's Trust Board meeting, and a request for the Health and Wellbeing to endorse the work programme over the forthcoming year. And obviously the Children's Trust Board is responsible for progressing the strategic objectives of the population and wellbeing strategy. And I just also wanted to highlight the work that's underway to progress a high-level children and young people's plan. There's a couple of areas that I just want to highlight that between the Director of Children's Services and the role that I'm in, and the DPH and the role that Sally's in, we have spent some time to bring back to the Children's Trust Board the review that's been undertaken in relation to the key performance indicators to make sure that they are smart and measurable. Then, as part of the overall ambition in relation to the development of the child-friendly town, all of the partners have been asked to sign a pledge to take that forward, and I'm pleased to report that almost all partners have responded with completing that pledge. And that needs to set out how each partner will strategically take forward the set of responsibilities to evidence the development of a child-friendly town, and will have a biannual position in relation to that impact. There's some important work that's been underway progressing the early help offer, and looking at how do we address the shortfall following the closure of the Flying Start Children's Centres. And that's focused on the work of the Early Years Alliance and the development of the virtual hub. It follows on from as well and builds on the the Flying Start strategy. It links with Active Luton, it links with Children's Social Care and the Family Partnership Service. And we are expecting at the next meeting a more detailed communications plan that kind of highlights that strategic intention to focus on right services in the right time in the right way, and ensuring then that the dissemination of that offer is known as broadly and widely as possible. And the final point, just to flag up, as part of that ambition around the child-friendly town, then at the moment we have previously described within the Children's Trust Board, and a high-level paper has come before the Health and Wellbeing Board previously that looks at the roadmap for developing the child-friendly town, and the biggest area where we would want to engage and work collaboratively with our children and young people, but we have been challenged around our capacity to do that until we have had the full Ofsted inspection. But that doesn't mean to say that activity hasn't been undertaken to progress that, and our and one of our key partners, ELFT, is taking forward the year of engagement, and as part of that, looking at bringing together partners so that we can have use every single opportunity where we're meeting with children and young people to ask some key questions and get their feedback, so that actually through that year of engagement we may well be able to gain a range of different young people's views to help support and put some increasing numbers of the building blocks in place. So I think that those would be the key areas that I'd want to highlight. The work programme is there. You can see that in the next meeting in March, the main focus relates to children with special educational needs and disabilities and having the right start in life, but also looking at the issues of educational attainment and disadvantage. Again, a key area of the population and wellbeing strategy, and one of the areas of kind of significant focus for our children and young people. Thank you.
Thank you very much, Amanda. And some extensive work going on there, and the tension between ambition and sufficient resources to deliver as fast as we would like. So that was coming through. Thank you. So comments and questions, please. No? OK, thank you very much. So we're asked to note the report and to endorse the work plan. So I think that's what we're doing, endorsing your work plan to continue. Thank you. And so now we move on to the Luton Place Board report, which I think is going to be Sally. Is that right?
Yeah, that's right, Chair. So just a verbal update really on the Place Board. So it's progressing well. I brought a paper last time laying out the governance of where Place Board fits with the emerging ICS governance structure, and I've subsequently taken the same paper to policy, and it has gone to exec as well and been agreed. So the formation of the Place Board alongside as a sub board of the Health and Wellbeing Board alongside the Health Inequalities Delivery Board and the Children's Trust Board, the three of them working together to deliver the health and wellbeing strategy has been agreed in the Place Board in terms of how it sits alongside the ICS and as part of the ICS integrated care system and structures has been worked through and agreed as well. So we're now doing a piece of work working through the work plans and priorities of the Place Board, linking to both the population wellbeing strategy priorities and the long-term plan and the ICS priorities. So the process that we're going through for that is having a senior responsible officer for each work stream, and then sub priorities underneath that related back, as I said, to the strategies that we have at Place. So that's being worked through, and further updates can be brought at the next meeting. The draft terms of reference have also been part of the papers here today. So it's quite a brief update today, but it's really starting to take shape and get legs and move forwards now. So there'll be further updates in the next meeting. So open to any questions.
So any questions for Sally? Yes, go ahead, please.
Mine's not a question, if I may. It's just a comment, really. I just think that I'm sorry that the paper doesn't have the children's element. I think that was just an oversight in terms of timing, because what Sally and I had discussed, and I think there was a discussion at the place-based board, was that it would absolutely be aligned with the Children's Trust Board and the objectives and the key areas that I've just outlined in the work programme. So I just think in terms of good governance, it's really important that the Health and Wellbeing Board notes the work programme of the Children's Trust Board that absolutely fulfills the objectives that are outlined in the place-based board, and we can send an updated programme that covers that, Sally, can't we, together? It's not that it hasn't been completed, so I just think for accuracy it's important that we note that. Thank you.
Yeah, absolutely. Yes, I thought it was a more up-to-date version that had been shared. Apologies for that. I think it was the wrong version that ended up in the papers. So we can circulate a more up-to-date version of that because there's been some other changes in the other work streams as well.
Thank you very much. We'll take note of that. And Thank you for your report. So the next item is also you, I think, Sally, Health Inequalities Delivery Board. So you'll show how we all connecting together.
Absolutely. So it's quite an interesting point for all three of the boards actually at the moment, because in the next Health Inequalities Board, similarly to the Children's Trust Board and the Place Board, we're going to do a bit of a stock take and review of our priorities and where they sit, and make sure that everybody has ownership of those, and that we have clear work plans, because we're all working towards the population wellbeing strategy. But I think it's very easy with these big strategies that need a lot of people coming together to lose focus on what we're all doing sometimes, and kind of have to stock take and think it through. So we're going to come back together with a clarity on priorities and objectives, and who's the lead for different areas, because there are certain things that are coming through to the Place Board now, but actually there's a different lens and a different focus on some of those areas. So that's in the next meeting. So again, we'll bring that back to the next Health and Wellbeing Board update. So in the last Health Inequalities Delivery Board, we looked a lot at the Talk, Listen, Change project that Chimeme has already presented on, and we also looked at some work that is being managed by BLCF, looking at COVID recovery, so linked very much to the findings of Talk, Listen, Change, and thinking about what we know about the community and the challenges through COVID, and thinking about funding community organisations to support COVID recovery. So BLCF are managing that on our behalf and progressing that really well. So we will get further updates to the Health Inequalities Delivery Board on that. We also had discussions around developing Luton as a marmot town. We are moving forward on that, and it's a very exciting piece of work. So we're managing to hone down our priority areas for that work, and setting up an advisory board and a steering group. So I've been part of the steering group already, and we've had quite a few meetings on that, but we're now moving forward with the advisory board, which will be chaired by Sir Michael Marmot. And the priorities that we're looking at through that work are looking at children and young people, which obviously is a huge target area. So we're looking at what exactly in that means. So are we looking at young people at risk of vulnerable young people at risk of harm? We're also looking at employment and skills, so very much related to the employment and skills strategy work that's coming on the agenda later, and colleagues linked into that work are part of the Marmot discussions, but also linking back to children and young people and thinking about increasing opportunities for young people, so linking back through to the children's priority. And then we're also looking at housing as a priority, but there's so much work already happening, great work in all of these areas, that really trying to think what's the additionality of the Marmot work, and how can we make sure that we're really building that in. So that's still very much emerging work at the moment. And then the other key element that we looked at in the last Health Inequalities Delivery Board was just looking at domestic abuse and the domestic abuse programme, which again reports to other boards and areas. So just making sure that things are aligned. So it wasn't a huge focus of the board, but just thinking about the inequalities element of it and making sure that we were making connections with colleagues around the table. So next meeting, I'll bring back refocused priorities and actions for the board, because we will have had the workshop in the next meeting.
Thank you. That sounds like a lot happening, and big project with the Marmot town. So any comments, please, either online or from the floor? No. Okay. So thank you. We were asked to note the update on that report. So thank you very much. You get a rest now, Sally. So it's primary care access now. So we'll hand over to, I guess it's Nikki. Hello, Nikki.
Hello, my name is Nikki Pullane, and I'm the Director of Primary Care, for anyone that hasn't met me. So the purpose of the report today is very much to update the committee regarding the work and it very much is about the experience of residents of access to primary care. So I'm hoping you've had the opportunity to read the paper. Just take a bit of context. In an average month in Luton, across the 26 practices, we have about 96,000 appointments, and that's a sort of a rolling average over the last 4 months. So there is a lot of activity, and if we just again look at fact, that's almost 70% of all of those appointments are face-to-face. So it just puts a little bit of context. Equally, in the same measure, in any average day, I haven't got it down to the Luton, but our 111 provider, which is the provider of primary care services, weekends and evenings, their numbers are particularly high. And you probably remember me saying in earlier meetings, it is we have 2 measures which are quite important quality measures: the time it takes for the telephone to be answered within 60 seconds, and we also look at abandonment rates. Now, we know that the rates for our 111 provider have been absolutely fluctuate. They fluctuate. The lowest we've got is about 30% of calls answered within a minute, and in a good day today, I think it was about 70%, and that is absolutely on demand and capacity, and that gets averaged out. Now, we're working very, very closely, and that's one of the reasons of bringing this paper today, is that primary care access really needs to be everyone's business. So if you had a chance to look at the paper that Sally mentioned a couple back, which is the Luton Place-Based Board, you'll recognise there's a work stream on there about primary care access, because sometimes it's about our residents not absolutely knowing how to use the service. So again, if I just look through the paper, what Amanda, who wrote this paper, was trying to describe, it's a programme. So the GP access is, and when I say everyone's business, and it is a programme, for example, the GP community pharmacy service is that, I mean, I think increasingly with the COVID vaccinations, particularly in Luton, they do over half of the COVID vaccinations. So community pharmacists are quite trusted health providers. So we're working very closely, and that is very much trying to support self-care, self-management, all conditions.
It looks like Nick. Oh, you're back. You're back.
Apologise. I've had all sorts of problems. I think it's the rain. Apologies. Did I keep you until I was talking about GP pharmacists?
Yes, you were talking about pharmacists and GP access. So yeah, we got that.
So of the work stream, so it is the importance of the community pharmacists I just really want to emphasise, and they are really trusted providers to our community. Also the work of the digital transformation, and that is absolutely making sure that we're not excluding with the digital inequality. So that's a very considered area of work, making sure that we are inclusive. If I also talk about the urgent care access, again, this is very much, and I know Paul's on the call today, this is absolutely making sure we're working as a system, because where any of our residents have urgent same day, we can manage a lot of those in the community primary care. So what we absolutely need to do together is making sure that people are using their GP practices by ringing those numbers or using the 111 service. And if they will be clinically triaged, and if necessary, they will be given advice to go to the A&E department with communication going to our local departments. I think in the paper, when we've talked previously, it's about really making our communication work better, because at the scrutiny meeting that I attended back in January, it was very clear to a number of councillors that it's not clear how the online works. You know, and equally the value of our online consultations, and we've got Nina here as GP today if anyone's got queries on that, but it's not a second rate consultation, is that increasingly our clinicians, and I think equally in mental health and in the acute sector, are using remote consultations effectively. But we again need to work with our residents so people become confident with it. Equally, we've got something called the Clinical Partnership Forum. And again, I've got Paul and Nina, who are the clinical leads, because that's about how we work together as health providers, making sure that the patients don't drop between, gaps between us. So, and increasingly that has been about, for example, if a patient's discharged from hospital, is that the follow-up tests are really clear to the patient. And again, it's not left in a sort of abeyance as to whether the GP picks it up or where patients have their follow-ups. So it is about that connectivity. And then lastly in the paper, we've talked about the winter access plan. And that is a considerable part of the work that we've been doing since November, because we have added capacity. So we have added additional appointments to what we had already, and that actually attributes to that 96,000. So I hope it's given an opportunity to see it is, one, it's exceptionally high priority, because as we say, primary care is the first point of contact, and increasingly with our mental health providers, with our end-of-life providers, it's actually about making sure that we give patients in the system so they don't always have to bottleneck back to the GP practices. So I'll take some questions if there are any, Nina.
Thank you, Nikki. Following on from the last meeting, I'm still getting residents constantly complaining about appointments at the GP. Totally understand what you're saying in terms of bottlenecking GPs, but the amount of people that I've seen where they've not been diagnosed with things, unfortunately, many diagnostics of severe illnesses like cancer not detected because people feel the pressure and the understanding of not going to a GP. Yes, the expectations of going to a pharmacy before all this, many residents would go there to do things. And it's quite alarming over the recent weeks where I'm speaking to different people in different places where they're saying, oh, well, I went somewhere, I won't name anything, but we're just going to the GP, to the hospital with my child. And I said, why are you going to the GP for your child? Why don't you just go to the pharmacist? Took him a few times, it's not. Why didn't you get an appointment? I can't get an appointment at a GP's. Do you know how you complain to it? And it's constantly particular practices, and I'm not going to name them, that are not, I'm not saying all GPs are there. I've heard some people actually say what a fantastic job, and they're able to go and see the GP. If there's barriers or if there's communication, people out there, the communities need to know that for whatever reasons, if you're going to call up every day at a practice and you can't get through, and when you get through to them from 8 o'clock on to 8:30, oh, all our appointments are gone now. Is it urgent? Yeah, you've got to discuss half your problem with a receptionist, to tell her what your issue is. Some people don't want to discuss that with them. And I think it's really important that we have the right communication for people to be signposted around when they need to go to a pharmacist and when it's urgent for them to go and see a GP. And I think the expectations that have been with people and the communities and the constant angerness around people that I've seen literally trying to get an appointment with a GP to speak to them about an issue really gets people down. And I don't know, and I've explained to them that we would be reviewing things, and the people and the impact on our hospitals are because people can't get the appointments at the GPs, and I've been hearing that for months now, and it hasn't stopped. So I think it's really important that we get the right communications out to community to understand where they should go for what treatment or how severe their issues are, in terms of if it's just a cough or whatever, and you can get something off the counter, then that's where they need to go. So, and they don't need to see the GP. But I think that communication to communities in different languages and understandings, maybe the videos, for them to know what they need to do and how they need to do that.
So I think that's I take the challenge, and I think I'm pleased that we've made it one of our priority areas in the place-based Luton place-based board about access. So again, very much welcome. There will be a number of task and finish groups. So I think probably one of the first would be to do a focus group, and if you could help facilitate that, I think that would be a way forward. So thank you.
I'm glad you've put your hand up, Phil, because I was going to invite you to comment at this point. So thank you.
Okay. I think we all know that people have difficulty getting appointments with a GP, and we should stop saying with a GP. We should say with appointment with primary care to deal with their problems. And I think that's part of the problem with the historical culture of people wanting to see a doctor, as opposed to a nurse or a pharmacist or whatever. and it does depend. There's been a number of attempts at getting communication out, but the message doesn't get through. And I do think it's a generational thing, which is going to take time to get through. I had a meeting with my practice today as chair of my PPG, which is struggling to get people to turn up because during the pandemic we did it virtually and people didn't want to do it virtually, and we're trying to reinstall that. But one of the comments which came from my practice, and something which is taking up their time on the telephone and obviously jamming the telephone to a degree, is they get a large number of calls about people inquiring about what's happened to their referrals, which of course is not their issue. It's the hospital's issue or the consultant's issue that it hasn't gone through. And I think there is lots of communication again where a member of the public goes to the surgery to get an answer on something which isn't within their remit to be able to deliver. So maybe that's something which needs to be included in the communication. And I don't know where people go to get the answer on where is my referrer in the system.
So thank you, Phil, for that, because that's an area of work that I'm working on in the Clinical Partnership Forum with Dr. James Ramsey. We convene at the Bedfordshire Hospital's site. And it comes up time and time again, and it's a frustration for individuals who are on waiting lists, and it's a frustration for the clinicians who are trying to manage them as well. And I'm sure that the admin team at the hospital are tearing their hair out as well. We have a clinical partnership forum tomorrow, actually, and on the agenda is all things outpatients. So it is a hot topic and we're working through it. But absolutely, we need better solutions for communication. We need efficiency. And then, as you say, it's about ensuring that is visible and communicated in the appropriate ways so that people know how to use it, know where to go and to spend their time productively. Because at the moment, they're making their best assessment, and why wouldn't they? But actually, it's frustrating for them and frustrating for everyone else. So it is a hot topic and we're working on that. And I think any intelligence that you get through the Health Watch would be good to feed into that piece of work.
Just on a positive note, I did have a referral last year, which has now been passed on to another department, but I was referred, it was taking a long time, and I phoned up the department at the hospital, and despite a number of times I got through to an answer phone where I left a message and realised that I hadn't left a phone number or whatever. But within 24 hours, the hospital phoned me back. The person had traced my phone number and that and phoned me back, and we had a good discussion and he sorted my problem out. And they were excellent, actually, in dealing with the issue. And I didn't go anywhere near my GP because I knew they wouldn't be able to address it. But once I'd phoned, they were superb in getting back to me with an answer and a discussion, and that was from their admin team.
I'm glad you had a positive experience. I'm hearing lots of others where it's not working as well for them. And as I say, I'm sure the admin teams are completely overwhelmed as well. But we need better solutions, yeah. And it is a piece of work that's ongoing. So any other points or topics related to primary care access? No, thank you. So the report was to note. Thank you very much, Nikki, and to Amanda for that report. Thank you. The employment skills strategy. and look forward to you're presenting, I think, Martin, are you? Debbie, right, yes, Debbie, right. So we look forward to hearing your input here. Thank you.
Thank you very much. So my name's Jodie Yandel and I'm the Service Director for Inclusive Growth. And joining me is Debbie Paul Hunt, who's actually on Teams, very much hybrid working today. So Service Manager for Economic Growth and Skills. And today we wanted to talk you through the draft employment and skills strategy and seek any views on it. So just moving on to the next slide. So the employment and skills strategy is a key pillar of the borough's pursuit of inclusive growth. It sits right at the centre of the 2040 ambitions around tackling poverty and transforming lives. And you can see there sort of the diagram which sets out the two key areas. And the employment and skills strategy, while it kind of sits within the inclusive economy strategy circle under the skills for the future area, it really does cut across both areas. So it really does kind of support both inclusive economy and population and well-being. And as Sally mentioned, that was a nice segue earlier, that it does really support the Marmot review and the aspirations that we've got around becoming a Marmot town. And of course feeds directly into that objective around creating fair employment and good work for all. Because we know that being in good work is protective, poor quality work and unemployment contribute to poor health, low well-being and an increase of risk of mortality. So just moving on, so this is the vision for the strategy. So what we set out here is that we want to deliver inclusive growth where Luton's residents are able to access the education, skills and employment support that they need to enable them to secure fulfilling, appropriate, sustainable careers throughout their lives, which supports the growth, diversity and prosperity of the local economy. And what we've done is really covered the whole spectrum of people on their kind of pathway into and onwards within employment. So the strategy is one that's for everybody so that no one is left behind. And you'll see there the areas that we're kind of addressing through the strategy. So this is about ensuring that residents fulfil their potential. It covers lifelong learning, so right from education and ensuring that young people understand the skills that they need and the careers pathways that are available to them, through to supporting those furthest from the labour market, through to the skilling and retention of those who are highly qualified, so making sure that those jobs are available locally and that they're able to access those. And also reskilling, so there's opportunities around career changes and particularly perhaps for those over 50 that are looking to reskill into different careers. And within this, we recognise that there are specific groups who face structural barriers and that will need to do specific interventions to target those groups. So whether that's long-term unemployed, BAME groups, young people who are NEET or care leavers, and there may well be specific action plans that sit behind those to make sure that we're doing all we can to support those groups. And by having that skill pool of local people, we'll also be aligning them to the local job opportunities and making sure that they've got the skills that employers need. So in turn, we'll be making sure that employers have access to a well-skilled population and therefore can grow and prosper as well. And finally, not forgetting kind of the entrepreneurial spirit of Luton. That's really important for Luton. So it's about making sure that we're providing those different opportunities from a young age. So just moving on to the next slide, thank you. So this slide kind of just sets a bit of background and framework. So the strategy is a partnership strategy. It brings together the local schools, colleges, universities, the council, DWP, and community and voluntary sector. Over the last 6 months, we've had some really intensive consultation, engagement and co-design with a wide variety of stakeholders, including our partners, but also businesses and local communities and people that are actually accessing those services as well. And actually, we're really proud of the momentum that we've managed to gain over those last few months. There's a lot of excellent work already underway. the strategy has to be kind of remain strategic and succinct. So we've not been able to capture everything, but it's not to say that there isn't a lot of good work underway, and we've kind of given a nod to some of that. But what the strategy does do is it kind of highlights the framework for where we need to be concentrating our partnership effort. And as part of this, we are asking partners to set out what their pledge will be about how they will embed this framework and these priorities within their own organisational plans as well. And then we've got an implementation plan which sets out these specific partnership activities. So we're actually working together, we really need to make that impact. And some of those activities will be borough-wide, particularly where we're kind of delivering from an institution such as the college or from adult learning. But it's also critical that we make sure that we've got provision in the local communities as well, and that we've got that local offer. So it will be a blend of outreach, local provision, but also making sure we've got really robust communication and engagement plans to raise awareness of what that offer is, where people have to go to provision that is kind of more anchored in colleges, etc. And where we have got that community provision, we really recognise it needs to be co-designed with the community, because they will know what they need, and we'll be looking for kind of those bottom-up approaches. So lots of work within the strategy around that. So just to highlight a couple of other pieces, so we've kind of mentioned the links with the population wellbeing side, and that's something that we've kind of highlighted there. Sorry, I'm back a slide. Thank you. And the final two bits is just around the recent publication of the Levelling Up paper. Lots of discussion in there around skills. So we need to make sure that we've got our framework agreed and that we can put ourselves in a good position for future funding opportunities. And also we're responding to, of course, the pandemic, both in terms of the challenges that's presented, but also longer term, the opportunities that we've got in Luton. So we've got some major projects and regeneration, and we need to make sure that we're making the most out of those in terms of our employment and skills opportunities. So I'm going to hand over to Debbie now, who's going to take us through more of the detail.
Good evening, everyone. Can everybody hear me?
Yes, we can hear you.
Thank you. So, following on from what Jodie has been talking about, I'd just like to share with you how co-produced this piece actually is. So it's not just a Luton-owned document in terms of the council. This is a Luton Borough-wide approach. We have engaged with over 300 individuals and organisations as part of the process and the consultation. That has been as part of employer focus groups, one-to-one interviews, community focus groups, a stakeholder conference, online surveys, member workshops, partnerships boards, job seeker interviews, young people focus groups, etc. And this is owned by everybody. So a huge amount has been done in order to engage as many people as is possible. Next slide, please, Martin. So one of the key things for our strategy is ensuring that no one is left behind. And that is so important for us. So the number of claimants has increased the most in more deprived wards of Luton, such as Biscot, Dallow, Farley, Northwell and South. In December 2021, claimant rates have been falling, but still remain high. So the key thing for us as part of this strategy is ensuring that no one is left behind. The strategy places people and communities at the centre of the design and delivery of employability services. It promotes a strengthened partnership approach where we work together with the community and voluntary community training providers to identify local needs and make informed, evidence-based decisions, flexing these to meet emerging labour market demands. We will be holding annual employment and skills summits to share insights, intelligence and activities, working with the Fairness Task Force, etc. and also ensuring that we have those conversations with those, not just the most deprived wards, but ongoing across the piece. Next slide, please, Martin. So some of the areas that we will be focusing on in terms of those sectors. So aerospace and aviation, absolutely critical in Luton and really important for us. Advanced manufacturing, automotive and engineering, creative arts and media, and actually those emerging sectors that we really want to focus on. So green economy, information, communication and technologies, and those large employment sectors where we have huge staffing shortages, so in construction and health and social care. So next slide, please, Martin. Some of those economic drivers that we have as part of that. So there are 5 main ones really. So pandemic recovery, so ensuring bouncing back better at pace and building long-term resilience with skills and employability propelling improved prospects. The next one, greener economy, tackling the climate emergency and progressing towards net zero targets, establishing greener jobs, sustainability embedded in work and life. Technology and automation, the increasing scale and pace of digital transformation, driving change, opportunity and skills requirement across businesses large and small. Changing employer perspectives, so a gradual shift away from traditional qualifications and attainment focus, and employers keen to assess overall applicant potential to recruit and deploy new recruitment methods. And then finally, changing that work dynamic. So working from home and increasing reliance on digital skills and support with well-being and resilience. Generation Z and millennials seeking that flexibility and work-life balance, and a huge value being placed on the good employer. So next slide, please, Martin. So we've got 4 main strategic priorities as part of the employment and skills strategy. So skills driving economic recovery and growth, developing a pipeline of talented and resilient people, tackling long-term inequality and economic inactivity, and creating an adaptable, upskilled workforce. Next slide, please, Martin. So some of those key performance indicators that we will be looking at. So, for example, reducing the number of hard to fill vacancies, increasing the proportion of residents in higher level occupations. For our second priority, developing a pipeline of talented and resilient people, increasing the proportion of residents with 5+ GCSEs, increasing the number of apprenticeship and traineeship completions. Priority 3, tackling long-term inequality and economic inactivity. So reducing the number of the proportion of benefit claimants and reducing the proportion of unemployed and economically inactive. And the proportion of total population registered as NEET and reducing those figures. So priority 4, creating an adaptable, upskilled workforce. So reducing the level of reported business skills gaps and shortages, reducing the proportion of residents with no qualifications or NVQ1, and increasing adult and lifelong learning participation levels. Next slide, Martin. So that's an overview of some of those KPIs. Underneath that, as you will have seen within the pack that was sent out, we've got really strategic implementation plan that really does go into the detail behind all of those things. Now, as I said earlier, this is a cross-borough strategy, and so different partners will be working on different things. So whether it's providers in terms of FE or HE, whether that's with employers, with schools, etc., And, you know, with the CCG and other anchor institutions throughout Luton coming together to make this strategy a reality. Next slide, please, Martin. So how will this be governed? So it's really important that this feeds in actually to something that Sally said earlier about there's lots of different boards, lots of different strategies that are happening and lots of great work, and we need to make sure that that is shared because some of these areas do overlap. So part of being a Marmot town is absolutely feeds into this with skills and make sure that we've got good quality jobs for people. So we have an Employment and Skills Partnership Board. So as you'll be able to see from the slide, there are lots of different representatives on there and partners on board, including FE colleges and DWP, the sixth form, SEMLEP, etc. There's also the Progression and Transition Board. So that is about education providers, including heads, sixth form, etc. So they will both feed into the Inclusive Economy Board, which then feeds into our Luton 2040 vision. Next slide, please, Martin. So now it's over to you, and I'll hand you back to Jodie if you've got any questions that you would like to ask about the strategy. Thank you.
Thank you very much indeed. There's an awful lot in this, and it deserves going back to several times, doesn't it? I'm taking my paper copy home that Bert's given to me. Thank you. So, questions or comments, please? Oh, sorry, Amanda, do go on.
Thanks, Debbie. Thanks, Jodie. I know that it was really helpful to have the discussion and the presentation at the Children's Trust Board and Luton Education Leaders. I know that, you know, the sort of depth and breadth of consultation and collaboration that's gone into this really important piece of work. Jodie, I just wanted to kind of pick up really the opportunity that we picked up earlier regarding, you know, linked to the sort of workforce and recruitment and retention, and I suppose this feels to me that it's a really the right place to kind of get an endorsement in relation to all of the key roles and the skill shortage and the challenges in recruitment, whether it's teachers, doctors, social workers, planners. And maybe it's something that the place-based board needs to come back to. And obviously we've had from Sally the report on the place-based board, but just when we think about the amazing offer and how we sell Luton, and then we think about our skills shortage, how do we work together in that place-based board? So all of those opportunities that that may attract a social worker in whose partner may be a teacher, somebody who may be thinking of moving and they're a GP, but they see the opportunity then to be a planner, you know, that we can move to a Luton place-based focus for recruitment and retention as we build and develop on the whole skills strategy. So it was just adding an additional dimension, and it may well be that we could ask the place-based board to pick that up as an opportunity. And, you know, Jodie, I know that you were in wearing two hats, kind of, you know, keen as well to support that as a way forward.
Yes, to respond.
Yeah, I mean, that's exactly the sort of thing that we would be keen to be doing. Actually, we've got, I was just looking back at the action plan slide that we presented there. There's an action around targeting skills development and employment initiatives on sectors and employers experiencing recruitment difficulties and shortages. And being able to kind of embed that within the various strategies and boards is absolutely something that we would want to do. So part of the work that we really want to drive forward is around our anchor engagement. So making sure that we are kind of joining up anchor recruitment strategies, and joining that up with the different agencies to make sure that we can promote local recruitment. And we've got a good business charter that we're looking to launch shortly. But the more we can kind of embed this strategy and the actions within those boards, I think the more we can really make a difference. So we definitely support that, and would be happy to join those conversations.
Thank you. And just following on from that, so that they've got the sort of town strategic level, but some of the participants within the board are primary care network clinical directors, and certainly I've read this today, shared it with colleagues. Sort of, this is of interest because when we're working with vulnerable groups in our practices and primary care networks, starting to understand the other connections that can be made to help people with their wider determinants of their health, that if that they're never going to get great control of their diabetes if their housing is poor and they haven't got a job, and they want a job. So starting to make those connections where actually we work with others and connect people, and then we'll pick up the health element of that. So I think it's really exciting. And I think it will be great to inform others in the health sector about this opportunity. And then, as you say, we're all looking to recruit. So how do we adopt good practices in employment and in recruitment and retention of our workforce going forward? And that could also contribute there. So yeah, I think it's really exciting, the connections that can be made here. Thank you. Other comments or questions from anyone? No, okay, thank you. So we're asked today to consider make any other recommendations. So certainly you've got the place board, and I say in terms of that's a starting point for connecting with health a bit more on a local level, I think, and informing on that. Thank you very much indeed for the report and the presentation. And all the work that's gone in so far. Thank you. So I think the final item on our agenda is to look at the work programme and see whether colleagues can spot anything that's missing from the next agendas, or if there's anything that needs to be brought to priorities. Bert, was there anything you wanted to say on that point?
Chair, the work programme is as given in the pack. So it's a question of the board deciding whether, whether the items are okay, and the number of items particularly, because obviously we tend to be getting quite a lot of items for each meeting. I think this is today has gone quite quickly, but sometimes it lasts a bit longer. So it's a question of, is it the number of items and the actual items themselves, are they okay? Some of them are standing items, obviously.
So is there anything anyone would like to add for the next meetings, or are you content that the due thought has gone into the planning of the next agenda and will deliver the appropriate reports for you? Yes, Deuce.
I was just going to say, in terms of the health observatory report that came out in regards to the health inequalities, would we be working with our partners in terms of the NHS to see how we can work with them to address some of those issues, and whether that can be incorporated with maybe part of that health inequalities piece of work that we're doing, or to explore more in terms of, I don't know.
So have we got, Sally, did you hear that?
Should I come in? Sorry. Should I come in?
Yeah, yes, please.
The the Information Observatory paper that's due to come back is around a proposal to look at shared ways of working in terms of health intelligence data, which is a collaborative endeavour that we're developing between our counterparts across BLMK as part of the ICS. So that update is specifically around what that might look like, how it's shaping up, whether people think it's a good idea, some of the detail behind that. But then coming out of that, once we get that up and going, absolutely we'd want to be able to look at health and care data in a better way that helps us look at inequalities and informs some of our work. So part of that and linked to it will be our work plan around the joint strategic needs assessment and the data that we can pull out through that and use that to inform our work. So I think some colleagues would have seen the first draft of the high level JSNA document, and then the next one will be around health and care, and then we'll be doing deep dives on certain topics. So it's all connected, but the specifics around the observatory is around what that might look like if we have a shared approach to that across BLMK.
So does that answer your question, Khadija, that we can bring it in, but it's some of it is going to take some time to
absolutely.
Yeah,
Absolutely. But I think it's important that we, in regards to the report that came out, to make sure that how it's affected people in Luton and how we're able to support that. And I think that links back to GPs as well, you know, people accessing or being referred to, you know, the inequalities around different practices. Maybe we don't know what the data is around here. So I think it's really exploring some of that to see why we have the health inequalities. So I think it is a wider piece of work. It's not going to be something that we can bring back straight away, but it'd be good to see some things coming through. Thank you.
We'll work that in. Thank you. That's a good point, Maze. Okay, so I think then, unless there's anything else anyone wishes to add on the work plan, so you've got endorsement for next time. Thank you. But then I think that is the end of the agenda. So thank you very much for your attention this evening.